Substance use disorder is obviously an incredibly important public health problem, and at long last seems to be getting the attention that it deserves. The entire speech of the governor of Vermont recently was about this matter. The Senate president at Massachusetts Senate made this a major priority in the recent statement she made. And I'm very pleased to report that in a strategic plan that MGH recently completed, making a major push on addiction use disorders, and in the communities we serve is going to be a very important part of this plan in our future. And we're doing that not only because we believe strongly in serving our communities, but we also believe that it can help reduce the cost of care as well for the populations that we're serving. So we're going to be counting on John and his colleagues in psychiatry and other departments to help make the promise of an expanded program in this area possible. A couple of factoids that were pretty startling to me and I think helped drive this recent decision of the hospital is that if you look across the country, 22% of patients in general medicine, general medical beds across this country are there because of, or at least partially due to substance use disorders. Within our high-risk care management program at Mass General Hospital, 29% of the patients are suffering from substance use disorders. And on our inpatient service, on any given day at Mass General, about 30 to 40 patients there because of substance use disorders. And so clearly there is a real opportunity to make a difference in the lives of these individuals by better connecting treatment with community resources in a comprehensive way, a real opportunity to make a difference in the health of these communities, and I think also a big opportunity to bend the cost curve by addressing this issue as well. So it is something we are very bullish about, and thank John and his colleagues for helping us develop some very exciting plans and that we will be moving forward with shortly. This professorship will give John more flexible resources to pursue his work, his clinical and academic work, and these professorships are really one of the greatest honors that we can bestow upon our faculty, and John is obviously very deserving of this recognition. He is the program director of the Addiction Recovery Management Program and is an associate director of the Center for Addiction Medicine at MGH. In October, we publicly announced the establishment of the Recovery Research Institute within the MGH Department of Psychiatry, and the aim of that institute is to present evidence about addiction recovery and how people with addictions can achieve recovery by engaging with communities to support their efforts or by helping these individuals seek treatment. So John is nationally recognized for his work in addiction care. He has served as a consultant to the White House Office of National Drug Control Policy, the U.S. Substance Abuse and Mental Health Services Administration Center for Substance Abuse Treatment, and the U.S. Department of Education and the NIH. A scholar as well, he is the author of many peer-reviewed articles, and he recently published the first comprehensive text on addiction recovery management entitled Addiction Recovery Management, Theory, Research, and Practice. So John, congratulations on this great recognition. Although we sometimes refer to these as chairs, we certainly hope you won't be sitting in it, and you will use it to move more quickly than ever before, because certainly the field that you work on needs your efforts desperately. So it is my great pleasure at this point to turn the floor over to Jerry Rosenbaum, who leads this great Department of Psychiatry. I sometimes joke with Jerry, I'm more than joking, that his department seems to have an infinite supply of very smart, very nice, very passionate, very caring, very creative people. And so I don't know how exactly he does it, but he does a great job leading this department and nurturing such incredible talent that we're blessed to have. So Jerry, thank you.
Thanks, Peter. And actually, one of the answers to that question is you and MGH, which really creates a fertile ground for psychiatry. Even more amazing than that an academic medical center would pick substance use disorders as its #1 priority coming out of the strategic planning process is the fact that we have so many psychiatrists, 200 psychologists, 300 or 400 psychiatrists, all part of a general hospital. How does that happen? And it doesn't happen anywhere else, so thank you. So thank you, Dean Flyer, and on behalf of MGH Psychiatry, welcome to friends, family, and colleagues celebrating John Kelly as the incumbent to this wonderful new endowed professorship, now named for John's mother, and one day to be named to honor him. John is a remarkable and multi-talented person. As his chief, I was well acquainted with his accomplishments and academic achievements, but really I came to appreciate what an amazing man he is during and after we spent some time together at the Puerto Rican Foundation for Addiction Research, a convocation that was held there. He is, of course, a brilliant clinician, researcher, and teacher, as you've heard, but what I learned is he is also a hoot. A crack-you-up, funny ad-libber who just catches you unaware with his humor. You know, he has this wonderful British style, and you think he's telling you deep truths, and then suddenly